Okay, welcome to today's Lunch and Learn. It's a deep dive into market research. I'm Renee Miller, the program coordinator at the Oregon Bioscience Incubator, and we would like to give a special thank you to OHSU's Oregon Clinical and Translational Research Institute, or OAKTRE as it's called, as our collaborator for this program, and it's part of their Invent seminar series. We would also like to thank Commerce Bank for sponsoring today's Lunch and Learn, and we really appreciate their support. And with that, I would like to introduce Susan Kane from Commerce Bank to say a few words. Susan?
Hi, good afternoon. My name is Susan Kane. I'm a commercial lender, relationship manager at the Commerce Bank of Oregon. We're a small boutique bank located in downtown Portland, serving small to mid-sized businesses in Oregon and Southwest Washington. We help companies with their full treasury management and deposit needs, as well as loans, from operating lines of credit, equipment lending, to owner-occupied real estate. I'd be happy to answer any questions about your banking and meet with you for a cup of coffee virtually to discuss. And I'm just more than happy to be supporting Neutrati today with this event.
Wonderful. Thank you, Susan. And now I would like to ask everyone to keep their microphones on mute so that we have our full be able to watch Michael McGarry give a talk today without any interruptions. And so I would like to introduce Michael McGarry, who's leading today's program. And Michael is the president and founder of Forvita, a customer-focused consulting firm that's passionate about developing health solutions that engage individuals and make health an everyday event. He is also one of our mentors in the OBI mentoring program. Thank you for presenting today, Michael. And if you're ready and you want to share your screen, the floor is yours, and I'll make you the spotlight speaker.
Okay, great. Thank you, Renee. Let's see if I can. Get this going here. All right, and I'll jump into. Okay.
Looks good.
So am I in presentation mode? I
Yes.
Can't see it on my screen. Okay, great. Well, first off, thank you for inviting me to join you guys today. Wanted to kick it off first with a disclaimer. This is not a polished presentation that I've given 100 times. It's more or less just a brain dump for 25 years of doing this on both the buy side and the sell side. So I launched my consulting business about 4 years ago. Prior to that, spent a good bit of time with Ascension Health, one of our larger health systems here, leading some of their innovation work, and was really responsible for evaluating new technology as well as developing new solutions in-house. And then prior to that, spent well over a decade on the medical device space, class 3 medical devices primarily, cardiovascular stuff, stents, pacemakers. So really I've gotten sort of a deep lens on both how and why hospitals make decisions, how they decide, where their dollars are going, but then also on the product side, understand where a lot of you guys are coming from in trying to crack into that market. So with that disclaimer, we'll jump right into it. So Ray said a little while back, there was a lunch and learn on what I'll call textbook market research. This is stuff, and I say textbook because it's literally the stuff, you can go to the library, get a book on it. There's all kinds of resources out there on the internet to really help guide you when you want to do market research. What I really want to get into today, though, is kind of peeling back some of the layers of complexity in the health system, focus somewhat exclusively on the US health system, of course. It's not always easy to understand, who's your customer. So I'll introduce a few definitions that we'll walk through today. But first, just want to do a quick recap. This probably looks familiar to a lot of you. When you think about market research, you've got your primary research, which is firsthand information. You got to get out there. You got to meet people. Use your networks. Go and talk to people. Don't just assume that what you're building, helps people, makes the world a better place, improves quality. get out there and really understand the nuances, not only of the market you're entering, but also the customers you're engaging. And of course, secondary research is all the stuff you're going to do, online, searching the data records, looking for, it's a great place to do competitor analysis, pull that information together. Some of the tools that you'll use for market research, interviews and focus groups. I don't need to read the whole list to you here, but again, what I'm going to talk about today doesn't replace this. In some ways it augments it, in some ways it's different, right? But I want to be very clear. Doing textbook market research is critical, right? You need to understand your market. You need to understand your competitors. You need to understand, where you fit in that bigger picture. But what I wanted to focus on today, as I said, is who is your customer, right? And it's not always easy in healthcare what you may think is obvious, hey, this is a product that a doctor would use, so they're my customer, but that may not be the case. So just for the sake of this discussion, I'll use these definitions. We can debate them later, but again, just for clarity on today, when I talk about a user, that's going to be an individual organization that is the one that's using your product. That might be a patient, that might be a caregiver, that might be someone in IT, but that's going to be the person who's sort of hands-on and using your product. A champion is someone who's going to endorse or promote your product. So they may not use it on a daily basis, but they see what your product can do for their health system, and they see it as critical to the success of what they're doing. They're going to be that internal cheerleader that says, we can't live without this product. A sponsor, as I use that term, is someone's going to provide that executive support, right? So they're not going to be the day-to-day cheerleader. They're not going to be trying to knock down barriers inside the organization, but they're going to, it's going to most likely be a CEO, a CFO, a chief medical officer, someone more senior in the organization that's going to say, this is aligned with what we're doing. I understand, the benefits and needs, and, I endorse using this product. The customer, and this is again just my opinion, is who's going to pay, right? At the end of the day, that's the question you're trying to answer as an early stage company. Is you may have all the physicians in the world that love what you're doing. You might have champions that are promoting it. You might have users that want to use it. But if you don't have someone that's going to pay, the life of the company is going to be pretty short-lived. The only point I want to make here is these roles are not necessarily mutually exclusive. An individual can assume multiple roles, right? So someone can be both a user and a champion, et cetera. So actually, Renee, I think one point we didn't make, please don't wait until the end. I don't like to just hear myself talk, especially in this Zoom world where I'm just talking to a wall. We want to use the chat group or the chat function. So if you got a question or want some clarity or introduce some comments, please use the chat function. And then Renee's monitoring that. She'll interrupt me so we can address those sort of as the discussion progresses.
Yes, absolutely. If you have any questions, just put it in the chat and I will interrupt Michael, and then you can open your mic and have a conversation about it.
Cool. Thank you, Renee. Just by way of example, right? How might these roles play out? These are some companies I think are probably familiar to most of you, if not all of you: Facebook, Instagram, TikTok. Who's the user? I think in this case, probably pretty straightforward. You, me, all the people that are willingly sharing all of their personal and social data for all these companies to use. Who's the customer? The customer in this case for most of these companies is probably the companies that are buying advertising, right? They're the one, they're the one that are driving revenue for these companies until they switch to a subscription model. The customer is most likely that company that's the company that's buying the insights into who you are so that they can advertise to you. Does the user play more than one role? And in this case, I would argue you're probably not only a user for these companies, you're actually part of the product, right? These companies are trying to optimize your use of the platforms They're trying to optimize the number of, minutes and hours you spend on the platform. They're trying to optimize the number of things you click. And so in that way, you're actually as much a part of the product as you are a user. And then the customer can play more than one role as well, right? The customer may actually be a user, right? They may be using the platform not only to advertise, but they may be promoting their business with their own Facebook page or whatnot. So I just wanted to use this as a sort of a simple, very common example, something I think everyone's going to be familiar with, just sort of sets the stage of what I want to get into of, sometimes user customer isn't as straightforward as you might think. The use case for today's discussion, and this was an actual company that I did some work with earlier this year. We ended up getting COVIDed, if that's a verb. And so we kind of shut down. It was an Australia-based company. We're looking to break into the US market. It was a clinical decision support platform. And most of what I want to talk today is going to be heavily influenced by my work in the last decade, which is really falls under the umbrella of digital health, right? So telemedicine, remote patient monitoring, customer, health and consumer engagement. I think it applies, if I go back to my days on the medical device side of things, I think it applies as well, the points I want to make today. But if you're bringing forth a new scalpel, if you're bringing forth, a new and better improved, 4x4 gauze pads, it's going to be a little more straightforward, right? There's established channels to get that product into the market. You're going to become part of the hospital supply chain, and it'll be pretty easy. I shouldn't say pretty easy. It's never easy, right? But it'll be a little more straightforward. In the realm of digital health, though, that's where the complexities of user customer, just like the examples I gave with Facebook and Instagram, those lines get a little bit more blurred. So let me just so that everybody's on the same page, clinical decision support, or do I get into that here? Yeah, I think I get into that a little bit here. Hold on, my screen's blocking, or my Zoom's blocking my screen here. So I'll explain a little bit about what clinical decision support systems are, just so you guys have context. Some of you may be familiar with them, but for the benefit of everyone, I'll just give a little highlight. So the first question I ask myself when I'm trying to unpack sort of who are those different people in the organization, who's that user, who's that champion, 20 questions, again, brain dump, it could be 22 questions, it could be 19. But for today, we'll walk through 20 of them. What is the benefit of your product? What's the problem you're solving? And you don't need to overthink this one, right? It's pretty straightforward. Why did you start your company, right? What are you trying to do? The use case that we're talking about here, human error is a leading challenge for most hospitals, right? It's fueled primarily by siloed data systems and fractured communication between teams, right? So the cardiology team doesn't know what the endocrinology team is doing. Data gets misplaced. Data is not delivered in real time. So that can lead to a number of errors, be they medication errors, be they lab errors, be they, we didn't get the lab results in time, so we did something else. I think most health systems would admit that, it's a real challenge. And clinical decision support systems aggregate data from multiple systems across. So your EMRs, your marketing systems, some of your enrollment platforms, billing systems, all these things all come together to create a real-time dashboard of patient activities. So we can pull, in real time, lab data as it happens, bed utilization data as it happens, hospital admits as it happens, and we can bring that all together into one common dashboard that gives really anyone in the health system at a glance view of what's going on, not only at the individual patient level, but also at the more macro health system level. So the problem, the benefit of this product is addressing the human error that is common in health systems. Number two, what is the key value proposition of your product? And so this is a little bit different than the first question of, what problem are you trying to solve? If you're trying to solve a problem that doesn't have perceived value, then you need to kind of really think, who am I selling into, and what am I trying to get done? So the value proposition, well, as I say, cash is king, but other ways to define a return on value. And I'm keen to use that term return on value because it's not always return on investment. As I say, cash is king. Dollars are always going to dominate. So what are we spending? What are we getting back? Is it cost savings? Is it new revenue? But there may be other things. We're driving efficiency. We're driving physician satisfaction. A number of other ways that value can be measured. You're going to grab the biggest share of attention, though, if you can show direct impact on cost savings or revenue, in my opinion. The softer targets are great, and always great to add them into your pitch or your product demonstration. But I would focus on, where are you driving revenue, where are you saving money? So in our use case, the CDS platform, it improves efficiency, right? So we're going to get greater patient throughput, bed utilization, those kinds of things. It improves quality, right? We're going to reduce errors and improve overall care quality. That's going to indirectly drive, both these things are going to indirectly drive cost savings. We really aren't going to drive new revenue, though. I'll get to a scenario where we might a little bit later on in the chat. But this play was really about cost savings, right? And so there's only a few people in a health system that really care about cost savings. It's probably your CFO and CEO, your clinicians, your patients. They're going to understand why it's important, but they're not necessarily going to drive their decision based on, hey, this is saving the health system a few bucks, so I should use this instead of that, right? So understanding that value proposition is, really getting to the heart of that balance of give and take, right? You're going to ask the health system or your customer to give something, give their time, give their dollars. They're going to need something in return. Be very clear on what it is you're returning to them. Who are all the stakeholders? And think beyond the obvious here. Does your product, what I mean by does your product create a ripple effect, is especially in the realms of digital health, you don't, you might think immediately stakeholders, well, it's going to be your CIO, your chief informatics officer, it's going to be your clinicians, it's going to be your patient, right? But for the clinical decision support system, the use case that I'm talking about here, it's patients, it's caregivers, both the clinicians, right, the licensed caregivers, as well as the family, right? There was an extension, there was an ability for the patients to allow others to have a view into what their healthcare data looked like. The chief information officer, the CFO, your quality officers, your nurses and care coordinators, HR, and you think, well, what does HR have to do this? Well, we can drive higher physician satisfaction, which is a huge thing for health systems to drive retention of their care teams, right? So HR might be really interested in what this product's going to do. Legal kind of goes hand in hand with improved quality, reduced litigation, right? Fewer human errors, less litigation. Operations, right? We're gonna maximize patient throughput. And then perhaps marketing, and I'll talk about this a little bit more, well, towards the end, when I discuss the concept of a halo effect. But again, you might be wondering, oh, what does marketing have to do with a clinical decision support system? And it gives the marketing department a lens into the patient, unlike they've ever had before, right? They get to really build a much deeper relationship with the customer that creates opportunity for them to engage. When you think about, I'm going to use the term customer somewhat generically here, but when you think about your customer, where are they located? So in the realm of things like telemedicine, there's state-by-state regulations that have an impact on how you can deliver telemedicine. And so when you're thinking about where you might go first, right? I'm going to go to Texas, I'm going to go to California, you probably can't cover the whole country at once. Excuse me. For some products, are there cultural considerations? I was doing a health engagement platform a number of years ago. It was around diet and exercise, those kinds of things. We really had to take cultural considerations into play, and that the food primarily the food, but some of the, the food we were recommending, the language we were using, it was primarily English and Spanish. But if you're entering into a geography that has a high concentration of other, other languages spoken, that may influence where you go and the health systems you seek to engage with early on. In the case of the clinical decision platform, we were looked at the whole US as far as that software is concerned. There's no state-by-state limitations. We did have a focus on urban centers, right? It was difficult in sort of your smaller, more rural settings to show that value, to really demonstrate the value proposition. They simply, rural systems just simply didn't have the patient volume to drive the cost savings that we would want to show. The other piece here, so in my note down below, competitive markets, know not only who you're talking to, but know what their competitors are doing. Especially when you get into urban setting, a lot of health systems are in highly competitive markets, right? Really trying to steal market share, from their neighboring health systems. You can use that to your advantage. You can give a health system, features and functions that their competitor may not. They may or may not ask for exclusivity. I would caution against that, but they can definitely have a first mover advantage, right? And so you can use those insights to your advantage when you're talking to a potential customer. The other piece here are global considerations. The US may not be the best market. When we think about value-based care or single payer systems, you might actually want to consider, are there markets outside the US that would be a better entry for your product? As I mentioned earlier, though, for the sake of this discussion, this is sort of a very US-centric view. What is the optimal size? So think about what you need to demonstrate your value proposition, right? Do you need scale? Do you need, and a lot of times in digital health, you need thousands and thousands of users. If it's an AI or machine learning program, you need to train those algorithms, right? So you need large volumes of customers or end users. Would you benefit from central decision making? And I'll talk about this a little bit more later, but what I mean there is, the years that I spent with Ascension, it was a $30+ billion health system operating across 23 states, 150,000 employees. I would strongly advise you don't go to them as your first customer. The scale seems incredible, and everyone's like, "Oh, that'd be so cool if I land Ascension as a customer." But it'll take you a year, maybe 2 years, just to find the right people to talk to. And I always chuckled when I had some folks that would come to me and say, I'd be at a conference or something. They'd be like, "Oh, that's cool. You're with Ascension. I work with Ascension too." And I said, "Really? Who do you work with?" And they said, "Well, do you know Dr. Jones?" I was like, of the 30,000 physicians that we have, I don't know Dr. Jones. And let me just, in a very polite way, but let me help you understand. You're not working with Ascension. You're actually just working with Dr. Jones, right? So central decision making becomes really powerful in that I have a bias towards sort of mid-size. And as you'll see in the use case, that's what we targeted: mid-size, sort of $1 to $7 billion in revenue, regionally located, single EMR, right? So you're not dealing with competing platforms or data systems, and then central decision making, right? Ascension has a CEO and a CFO and a CMO for every one of their what they call health ministries in every single market. So you might be able to sell to one of them, but you're not going to then sell to all of them. You might be able to sell to corporate, but then corporate can't necessarily insist or demand that all of the health systems use whatever you just sold to corporate. So really focusing on those mid-sized systems allows you to find in the world of Goldilocks, right? Not too big, not too small. You can get to faster decisions, but still have the scale that might benefit, demonstrating your value proposition. Does your product create the need for new jobs? And this is both good and bad. If you create new jobs, you're gonna have some folks in the health system that might say, job growth, this is good. It might be justification for them to bring on new employees that they can use in more than one department. right? So understand if you need new people in an organization to support your product. Where it's bad, of course, is you got to sell them on not just your product, but you got to sell them on the need to bring in new jobs. And if a lot of, especially today with what's going on with COVID, a lot of health systems have a hiring freeze, or they're downsizing actually. So as an example, the use case of the CDS platform, if the health system didn't have a really strong data analytics team, it was strongly encouraged that they did bring that talent in-house. The company could get them up and running, but wouldn't manage the system, manage the data on an ongoing basis. So you really, in that scenario, we really needed a robust data analytics team, which isn't common necessarily it's becoming more and more common, but not every health system has one. So be aware of what support you're going to need for your product, and if it exists with some of the customers that you're entertaining having discussions with. On the flip side of that, does your product eliminate jobs? And again, this is both a good and bad thing. It may be good for the CFO who says, "Hey, we can cut costs. We can eliminate some of the headcount." Of course, if you're the person or the department that might be facing job elimination because of this new product, you might find them a point of resistance within the organization. So again, it's neither good nor bad. Just understand how that product you're bringing into a health system is going to impact the bigger picture, right? Impact the overall health system, not just the user that might benefit from the product. So for the CDS platform, it wasn't likely that we would eliminate jobs, but perception of job loss is real, right? And I talk about this a little bit later, this notion of antibodies, but the perception of job loss, there's a real fear. So this was an AI-driven platform, right? So this question of, will I be replaced by AI, clinical decision support, physicians thinking, well, am I going to be out of a job and be replaced by this really smart computer? And in some cases, it's absolutely absurd that that individuals would think that way, because there's some places computers just can't replace someone. But it doesn't stop people from having that perception, and that can become a barrier for getting that champion or getting that sponsor on board to really help drive your product, into the system, not only through the sale, but implementation and scaling of that product. So be mindful of, again, not only the real, but the perceived impact, because that can influence people's decisions.
Michael?
Yeah.
Pardon me. Sorry to interrupt. Jennifer Greenberg has a question. Can you talk a bit more about the role of uncertainty in change and product adoption cycle? And Jennifer, if you want to open up your mic and add any more to that, you're welcome to do so.
Yeah. Hey, Michael, I think what you were saying was really key, right? Is that people start to imagine things and make things up in their head if they don't know what's going to happen. And you touched on that a little bit, and I wondered if you had any more thoughts about that, because I think it's so important.
Yeah, absolutely. And you're kind of leading into, I think it's in one or two questions I get into that is, in addition to sort of job creation, job loss, where are you going to introduce some pain points, right? Clinical workflows was one I think you mentioned, right? EMRs are probably the classic example here, right? They were supposed to be the savior of health systems and make the lives of clinicians 100 times better, and they've been nothing but a nightmare. It's a huge generalization, right? But they required all kinds of workflow changes. They required all kinds of training. They require massive amounts of data input and data entry on behalf of the physicians. Some physicians estimate they spend 50% of their time just entering stuff into a medical record, completely opposite of what the promise of EMRs, claim to bring to the table. So the negative impacts, let me think about if that's the right to say negative impacts, right? But just be really aware of how your product is going to impact the whole system, right? Not just one user. I think we tend to get really granular and focus on that patient physician relationship. But I think it's so critical to recognize the health system is an entire ecosystem. And when you introduce, just a little wave in one department, it may carry over into multiple arenas. If there's a theme at all today, I think that would probably be it. Does that get close to addressing your question? I'm going to hit it a little bit more in a few questions too. Okay. We'll even hear the eighth question: who will you help and how? The obvious is a health benefit, right? The use case. Reduced human error is not only great for the health system, it's great for the patient, right? Who's not subject to that error. We're going to save time. We're going to reduce complexity in the long term. But getting to the prior question, we're probably going to introduce some complexity in the near term, right? During that implementation phase. I think we covered some of this other stuff: reduced litigation, increased capacity for hospital cost savings. Those are all the benefits that we want to talk about. And again, they span the entire organization for this product, not just the patient who's going to, or the clinician who's going to make less errors, and the patient who benefits from that. Who will you hurt and how? The two biggest areas that I see this are added work and added cost. EMRs not only hit both of these buttons, right? Added work for so many people in the organization, but while they claim to reduce costs, and I think in some areas they do, every time you need to upgrade your EMR as a health system, I want to remember the numbers. I want to say for Ascension, it was a $50 million project to upgrade their EMR across the system, right? So unless you can back up those added costs with immense savings, it's going to be a really tough sell. So in the case of our clinical decision support system, it was definitely added work for IT up front, both in implementation, getting the platform in-house, getting it set up on everyone's computers. It was a challenge with integration. If you remember, I said, one of the strengths of the decision support system is it pulls data from multiple sources and aggregates it in one. But that doesn't happen automatically, right? It requires a fairly sizable integration effort, which is going to take a lot of, or it's going to put a lot of burden on the hospital IT system. Even if the hospital IT system sees the value in the product, arguably they've got 20 other high priority projects in their queue, and they may say, maybe this is great, but we just can't get to it this year, right? So understand how that's going to impact it. And the other piece, I think this gets a little bit to the question of workflows, is it's going to require training for multiple departments. So this gets into your operations teams, your HR teams, right? It's rare that you just drop a product into a health system and, have people adopt it and use it the next day, right? It's got to be integrated into the clinical workflows, training. People have to know how to use it. There's a lot of people that aren't going to, they're going to be resistant to learning just because of the time they have. And so they're going to be making, they're going to, this product's crap and it's hard to use because they didn't take the time to train. That's going to introduce complexity. HR is going to hear about it. This is terrible. IT is going to hear about it. This program is, this platform is crap. I hate it. When it's probably tied to user error, the product might be great, but the users weren't appropriately trained. And as soon as IT starts hearing those complaints, you're starting to lose one of your champions inside the organization, right? So be really mindful of sort of the negative impact of where your product might have across the organization. Where are the antibodies? And I mentioned this earlier, and I think I just, they're most likely in the places where you're going to hurt someone, right? so know the bigger picture, right? And I think I just walked through this a little bit. In the use case, it's definitely gonna be on a case-by-case basis, right? So every health system, the running joke in the industry is if you work with one health system, you work with one health system, right? They all have their unique challenges. They all have their unique governance structure, sort of how their teams are set up. So you can't make a blanket statement of, the IT department's always going to be the antibody for a new IT program. It's really going to be, you have to know your audience. I say it's likely your chief medical officer in IT again, a massive generalization that I'm reluctant to put out there, but I did. Your chief medical officer is really going to be looking at, how their physicians are performing. Are they happy in their job? What kind of retention do I have? Are we delivering, quality care? And then IT is going to be responsible for putting a lot of this stuff in there. Your quality departments might be another area. Be mindful of, recognizing you're not the only product that's trying to sell into this health system. So be mindful that there are competing budgets. I've had a number of projects that I had tremendous support for internally, but someone else had a little bit more support for something else. And there's only so many dollars in the health system, right? So it may not be that they don't like your product. It may be they simply like one or two others a little bit more, and that's all the budget they have for, to put something new into the system. Competing research agendas, again, these can work for and against you. If you've got the chief medical officer is really hell-bent on sort of driving the organization in a certain direction, you want to know that, right? You want to know, is this an individual that can really become a sponsor of this product, a champion of this product, or is their head somewhere else, right? So that's where the antibodies are going to pop up. Recognizing that you probably have 10 times the number of no's in an organization as you do the number of yeses, right? And it's not because, again, that people don't see the value in your product. It's just that they're trying to get something else done, and recognizing it's a closed ecosystem and they can only do so much at any given point in time. So, know the bigger picture, do your homework, talk to multiple groups across the organization, not just what not just who you see as your perceived user. Building on that, are you aligned with the strategic priorities of the organization? And this one I found to be really important. CHNA, a community health needs assessment. Virtually every hospital has to complete one of these. I think they do them every 3 years. It's a great place to start, right? Understand the needs of the broader community, not just the health system, but what's going on in the market that health system is serving. Right. So is there a big challenge with diabetes? Is there a big challenge with obesity, substance abuse, access to care? Understanding sort of those macro challenges and the strategic priorities of the health system will really help you identify if this is a good place for you to place your bets. Right. It's pretty easy to get into a health system and get a physician on board with what you're doing. Especially if it's a product that helps their patients and helps them personally. But if the product you're trying to get into the health system isn't aligned with the greater strategic priorities of the organization, I think it's a fair bet to say you'll probably encounter more antibodies, more people that'll say no, again, not because they don't like the product, but because they're trying to get other stuff done and they only have so much bandwidth. IT is going to be the classic example here. If you're trying to implement, a digital health platform, IT is just buried usually and have a backlog of projects, and they're not really excited to take on new stuff, especially when they know anytime they take on something new, it's probably going to create some friction and pain points down the road, right? I think we all are fairly believing in the fact that software just doesn't go the way. There's always going to be some bugs and errors and whatever, right? So really take the time to understand those strategic priorities. Read press releases, read the health system's websites. And the word of caution there is a lot of health systems will talk, what they do isn't necessarily what they say. So their websites and some of the public facing sides of the health system are going to be, big picture, improve the health of the community type stuff. But, find some nurses, find some folks that are on the front line, find out what they think the strategic priorities are for the organization, right? And those folks are going to be a little bit easier to access. You go to the hospital cafeteria and just camp out, and spark up a conversation with anybody that'll talk to you, right? Understand, sort of the nuts and bolts of the health system. For the use case we're walking through here, it's really easy to say, and I present this use case as a sort of a cautionary tale. It's really easy to say this clinical decision support system is aligned with the quadruple aim of virtually every health system, right? We want to improve quality and outcomes. We want to reduce cost. We want to improve the patient experience. And we also want to improve the clinical experience, right? We want to make sure our doctors and nurses are happy. But you can't stop there. You can't just say, oh, well, we hit the quadruple aim, so we're in. Each health system is going to focus on those efforts a little bit differently, and they're going to prioritize how they're going to do it. Are they going to do it with remote care? Are they going to do it with quality improvement? Are they going to do it with a new facility? Are they going to do it with adding new services, right? Understand, again, at that deeper level where they want to go. I say here, it doesn't have to be the CEO, right, that you want to sell on this, but it doesn't hurt, right? If you can get the CEO on board with what you're doing and demonstrate how you're aligned with the strategic priorities that individual has set for the organization, they become a great champion and sponsor of your product. Does your product create new opportunities to drive revenue? Here, it doesn't have to be the CFO, but again, doesn't hurt, right? The CFO is going to be the one that's most concerned about how the dollars and cents are flowing through the health system. This again continues on this notion of think bigger than just what your product does. In the use case here, the clinical decision support platform, the logical evolution for this is to drive deeper relationships and extended care beyond the hospital, right? So the near-term win for this product is get in, understand what's going on in real time, and serve that information up to the right people so they can make better decisions. But as you're aggregating all this data, you're getting a much deeper understanding of your patient. You're getting a much deeper understanding of how your health system can engage with them, which opens up the door for whether it be outreach and marketing activities, whether it be extended care platforms, right? So extending beyond the services you offer inside the brick and mortars of the health system to remote care. So building a case around that of, here's what my product does for you today, but here's what it can do for you in the future becomes a compelling pitch, for most people in the health system. What are the switching or integration costs? Don't try and replace an EMR. For as much as everyone hates them, you're talking about a 2 to 3 year sales cycle to try and get that done, right? So again, understand, what are the products that the health system's using today? And if they're going to have to switch that out for what you're providing, how painful is it to remove that existing product? And then integration, I think we hit on that a little bit earlier. The more systems you have to connect to, the more departments of the hospital you have to kind of become part of, the more work you're introducing. So just be careful of, what are they using and what are you trying to replace if you are. Here, I say it doesn't have to be the CIO, the chief innovation or chief information officer, separate eyes in the CIO title. But it doesn't hurt, especially in the realm of digital health, right? That's probably the key person you want to focus in on. Does your product require workflow changes or training? And in the case of the clinical decision support, yes and yes. I think we hit on this a little bit earlier, so I'll, in the interest of time, move quickly past this. But again, just be mindful of, health systems have systems that they've probably had in place for a year or longer. And that change management process can be a real nightmare, right? So you want to understand their existing workflows and demonstrate how your product works within those, not disrupts those. Here it doesn't have to be your chief medical officer, but it doesn't hurt, right? That's probably the folks there, chief nursing officer, chief medical officer, the folks that are really responsible for the day-to-day delivery of care are probably going to be the most impacted and likely become your greatest antibodies if you're going to disrupt that existing workflow. How long does it take to demonstrate measurable value? And this goes back to, I think it was, the second question is what's your value proposition? The note I have here, if it's more than 12 months, rethink your product or value proposition. Especially as we move towards value-based care, there's a lot of new products and services coming to market that are saying, diabetes management is a great example. Hundreds of products that seem to be coming on the market for diabetes management. But with the exception of sort of your really late stage, sort of heavy using health, diabetes patients, multiple comorbidities, et cetera. The return on savings for a diabetic is probably measured more in 5 to 10 years than in 12 months. And why that's critical is the hospitals operate on a 12-month fiscal year, right? And so they're going to be putting dollars out this year to pay for your product. They may not realize those dollars for another 5 years. That's a really tough sell. So understanding that, that rev cycle becomes critically important when you're thinking about how you're going to position your product, within that audience. As we switch to, as I said, to value-based care, when you look at fully integrated health systems, they're going to get a better sense of the long-term value, the lifetime value of a customer, those kinds of things. So you'd probably want to target your efforts there. If your return on value is more than 12 months, I'd all but abandon any discussions with health systems that are still primarily fee for service. And value-based care is definitely the buzzword. I think everyone believes it is the wave of the future. My personal opinion, we're probably 10 years away from it being sort of the common means of delivering care, though. So we're still very much in a fee for service world, and will be for quite some time. In the use case for the clinical decision support system, that platform could demonstrate efficiencies in the first month and improvements in quality in the first quarter, right? So a really great fit. That's a pretty easy sell to demonstrate that return on value. Are they potentially strategic partners? Again, thinking beyond just the users and the direct benefits of, how is this health system going to help you, or how can you help them in a way beyond that customer vendor relationship, right? I think I have so this just came across my desk last couple of days. This is Tampa General Hospital, leading academic medical center, launches new venture capital fund, Tampa General Hospital InnoVentures, right? You're seeing this, especially in mid-sized health systems. You're seeing this every day. Every health system is popping up these innovation centers. What I really, really love about that is it provides a front door, for you to get into. So, these are groups that are not only going to help you identify sort of who those stakeholders are in the organization. They'll help drive implementation, but more importantly, they might become an investor of your company as things go on, right? So can they be more than a customer? Can they be a strategic partner? Is a critical question that I try and understand. What's going on in the world, right? Know your audience, know their problems. An obvious example right now is COVID-19. I was working on a project for about a year and a half, and in February of this year, it vaporized in about a week. I had 6 health systems involved. We were literally using a football analogy, we were on the 1 yard line. We were negotiating sort of final contract agreements, and then COVID hit and completely wiped out that year and a half of work. The shift to value-based care, I talked about that a little bit, right? Where is that health system that you want to talk to? Where are they on that journey? If they're heavily fee for service, know that. If they're got a ton of risk-based contracts, know that that's going to influence who you talk to and what you talk to them about. For the clinical decision support system, ROI is optimized for both value-based care and fully integrated health networks, right? So that's who we were targeting there. We didn't even touch fee for service. Be consultative. The note I have here, help them to see the bigger picture, right? Help them become a better health system. It's not always just about, can I sell my product in to your organization? It's how can we build a relationship and together make this care experience better, right? How can we build a better system together? I found to be very effective, right? So focus on long-term relationships, not short-term transactions. I might have just given away the answer. Are there any unintended consequences? And this is always a fun one, right? Because you get laser focused on what it is you can do, but there may be some unintended consequences, and hopefully in a good way, right? You want to know if there's some negative ones as well, but for the clinical decision support system, I think I hit on this already. We really drive a deeper understanding of clinical workflows and patient experience, provides insight into care that can deliver into care delivery models. and allows for rapid testing of new ones, right? So once this platform is populated with, a year, 2, 3 years worth of data, it becomes an incredible system for the hospital to try a new care delivery model and then rapidly test that. Is that impacting quality? Is that improving care? So that would be sort of an unintended consequence of that. One of the best examples that I think I've come across in my life in this industry here is a question to the group. Again, hard to answer this in Zoom, but what's the most successful health engagement app of all time? And you've got some real great contenders out there, your Fitbits and Apple Watches, and Whoop is a new one that's out there. All these platforms and products that are focused on health engagement and trying to get people to improve their health behaviors. But I would argue probably the best health engagement application of all time was Pokemon Go. It was a game, but when you look at the data, they added thousands and thousands of steps to millions and millions of people within the first month or two of launching that platform, right? So don't get so laser focused on the immediate benefit. Think about, what ripple effect you're going to have, where you might have additional benefit beyond the obvious. And then, getting into that oh so critical question is who's going to pay, and don't just make assumptions. The doctor's going to pay, the patient's going to pay out of pocket, the hospital's going to pay. Get your hypothesis, get your assumptions, and then go validate that. Get into the hospital and talk to the CFO, talk to the CMO, whoever. There's going to be harder folks to get to. But I can't tell you how many early stage companies that I'm in discussions with, and they're like, well, patients are going to pay out of pocket. Rarely the answer. Physicians are going to pay. Almost never the answer, right? So what this all boils down to is who's going to pay? Who's going to pay for that product? And you need to find who that person is, and then convince them with your users, your champions, and your sponsors. So again, I would say the customer is the one that's going to pay, but you need this other body of folks. They're going to stand behind your product and say, I absolutely think we need to use this. It's great for the organization. So that customer, the one that's going to pay, has all the justification they need to make that purchasing decision. So sort of in summary, for the clinical decision support system, I would break it down this way. Our users were the clinicians and IT. Our champions were going to be the quality teams and the chief medical team, or the chief medical officer. The sponsor is probably going to be the CFO. I would want to sell that CFO on the cost savings. And the customer is going to be the CEO, because the decision support platform really spanned the entire organization and had broad impact on the care delivery. And so at the end of the day, we felt we would have needed CEO buy-in to authorize the purchase of that product. Now after that, CEO would rarely be involved and have nothing to do with the product, but that was the person we needed to sell for sure with that product. And then the final one, sort of a bonus question, I thought of this after my 20 questions, is does your product provide a halo effect? And what I mean by that gets into hospitals that are in competing systems. Their perception to the community matters. So are you the first to deliver your robotic surgeries? Are you reducing ER wait times? Are you giving the health system something that they can promote to their broader community that makes them look better, right? That halo effect. By using this product, your health system will have a more positive representation in the community, right? Here I say it doesn't have to be the chief marketing officer, but it doesn't hurt, right? Chief marketing officers are always looking for a way that they can position their health system in a way that's better than the competitors in the market. I think that's what I got today with 5 minutes to spare.
Thank you, Michael. This was really great. I love the bigger look, the wider look at the ripple effects and who the product benefits and who it doesn't benefit, and a lot of questions to think about that maybe early stage businesses, companies didn't consider and should consider. Does anyone have any questions for Michael? Feel free to just open up your microphone and ask. Nick is asking if the slides will be available. Yes, I will send the slides along with the recording, and I'll send that out probably tomorrow. So while I'm waiting for questions to come through the chat or someone to open up their microphone, I'm just going to put up a quick poll, and I would appreciate if you could fill it out. It is a survey poll that we always ask whenever we do a lunch and learn, and it is to help improve our programs and events. And I would love it if you would answer just those 4 questions. And if anybody has any questions for Michael, you covered a lot of material, 20 questions, all very important, all different, really some great deep dive into market research in a different kind of way, really finding out who's your customer, who's your user, who's paying for this, and how is it going to impact the organizations as a whole. Skip Brung asked, what is the first top clue that a customer isn't going to work out?
Oh God, great question. I would you're going to get the first clue and I would completely disregard it. And then you're going to get a second clue and I would completely disregard that. It goes into those antibodies, right? You might be talking to a chief financial officer and realize after the first conversation, you need to be talking to the chief medical officer, right? So I don't want to pretend like there's some blueprint that you can follow. It's really going to be on a customer by customer basis. So the first clue that you maybe pay attention to is the accumulation of maybe 3 or 4 or 5 clues, right? Of people saying, I don't think it's a good fit, but don't give up with that. Just because the CFO says it's not a good fit, don't give up on that, right? Go talk to somebody else in the health system.
Okay, good. Carlos asked, how do you get to the hospital CEO? It isn't going to be simple.
It's not, right? And so that's what I was saying, and a great question, because it becomes really tactical. Through those health innovation centers that all of these, that so many health systems are setting up, that's a great way. But you probably do need to start from the bottom up, right? So build those champions, build those sponsors. If you can get to a doctor, if you can get to a nurse, if you can get to someone that's sort of mid-level, and win them over and then sort of build. But the likelihood you're going to just ring the CEO and get a meeting in a week is almost zero, right? So great question and great clarification. I really view this as a bottom-up process. Start wherever you can get in and then just keep winning people in the organization until you get to where you need to go.
Excellent. Good. Karen Berg asks, she says, thank you for openly sharing your knowledge. And then she asks, what success stories do you have in generating warm introductions to the medical center venture capital funds you're talking about?
Again, what's great about those organizations is they're actually out looking for you, right? They probably have someone in there who has their sole job. Like when I was at Ascension, it wasn't my sole job, but 30% of my job description was scanning and networking, right? I was out there looking for the next best thing. We were developing stuff in-house, but a big part of it was finding knowing the problems we're trying to solve as an organization and going and finding those solutions, right? So that's going to be one of the most likely areas where they are going to return your email. They're going to return a phone call. If they're geographically close to you, make the 2-hour drive, and just go walk in the front door. But if, you should get a warm reception from those teams, because again, that's their job. And what I really, really love about that is, 10 years ago, it was virtually, it was so uncommon that a health system would have those capabilities. That one of the biggest problems I tried to solve at Ascension in the early days was creating a front door, right? Creating that entry where an early stage company could walk into and and get the information they needed to get to understand if there might be a good fit or if they can get support from the organization. So, and you're going to get a lot of no's, as everyone tells you, right? So, but if you queue up, 10, 20 or targets of those health innovation centers, I'd be surprised if, or I wouldn't be surprised if, 10, 12 or more respond to your inquiry.
Great, thank you. Wow, looks like we are about out of time. Thank you, Michael, so much. Thank you for all your information that you've given. And thanks to Commerce Bank, thanks to OHSU Oak Tree, and all of you for making today's Lunch and Learn so enjoyable and informative. Again, as I said, this program was recorded, so look for the recording in your email tomorrow, and I will attach Michael's slides. Thank you for that. And we appreciate your support of OBI and hope you have a great rest of the week.
Great. Thank you, Renee. And thank you, everyone, for joining.
Thanks, everybody. Bye-bye.